Internal condoms, sometimes called female condoms, but are now recognized to be used by people all across the gender spectrum, are an internal barrier method that can be used by people with vaginas or used for anal sex. Like its name suggests, the internal condom is used internally in the vagina or anus to protect against pregnancy and STI transmission. They are typically made with plastic and have an outer ring and an inner ring. First, you want to make sure that the packaging is intact by checking for any visible tears or liquid from the internal condom lubricant. If you are using the internal condom in your vagina, pinch the inner ring on its sides and place it deep inside the vagina. You want to get the ring to sit flat against the cervix. The external ring should sit well outside the vagina and cover some of the labia minora, which can help provide additional protection against STIs. Make sure that the condom is not twisted. Then, when inserting the penis or toy, make sure that the penis or toy does not slip between the condom and the wall of the vagina or anus by holding the condom open. In addition, make sure the outer ring remains outside of your body.
If you are using the internal condom in your anus, remove the inner ring and place the condom in the anus using your finger. Make sure that the base of the condom sits outside the anus.
When removing the internal condom, twist the outer ring of the condom, if there is semen in the condom, in order to make sure that the semen remains in the pouch. Gently pull the condom out of the vagina or anus and immediately throw in the garbage. Remember that internal condoms should only be used once, so you should use a new one with each sexual act. Thanks for watching! Be sure to check out UChicago Student Wellness or talk to an in-touch peer health advocate if you have any further questions. Check out our other demonstration videos for further barrier method information. Thank you!